My name is Gisela Garrison. Our main focus is to reach out to the peoples and families in this community who historically did experience very large difficulties accessing medical care. For example, there is no pediatrician working in this area, and the closest access to a pediatrician would be driving at least 42 miles to the next larger town, which is Steamboat Springs. Access is only one challenge that this community experiences. The other reason is basically the attitude of the Westerner families, the ranchers, farmers, coal miners, the people working in the gas industries, the attitude of we need to take care of our own problems without asking for help, and so they would not go to a physician, to a doctor for medical care unless they are extremely ill. This affects definitely the preventive care that we would like to implement. Our big goal is to educate the community and offer them options to receive care on a preventive level so that they can make healthy lifestyle changes and choices before their diabetes is out of control or before their chronic asthma brings them to the emergency room with uncontrollable asthma attacks. We basically make it possible that every child that calls in and needs to be seen this very day can be seen the very day. And so we avoid the emergency room visit for those children. The parents come to us and receive a very low charge for this visit.
I am Jennifer Mora. I'm a family nurse practitioner at the Northwest Colorado Community Health Center in Craig, Colorado. Most of the kids I see come from families that don't have much money, many resources, and a lot of times just are not aware of the importance of preventative care for their children. We try to emphasize preventative care well child exams whenever children come in for acute care visits. One of the reasons well child exams are so important is because you can very often pick up on things that might not previously have been noticed until later on when an illness or developmental delay has gone unnoticed, and a child might fall behind in school or their condition may worsen. Particularly here, I see a lot of kids who, when they come to a well child exam, they have not had any dental care at all. The families don't realize the correlation between good dental health and overall health. The challenge in this area is, like all over the country right now, lots of economic hardship. Many people have lost their jobs. We see a lot of patients who have previously had insurance, and they'll come to this clinic and be pretty sheepish about the fact that they no longer have insurance. Because medical care is often perceived as acute care, or the need to go only when you're sick, it's considered an expense and something that's time-consuming. You take your time off of work to bring your child in, and really, if you take the time to take your child in for, like, example, for a well child exam now, then it could very likely prevent needing further expensive medical care or frequent doctor's visits.